Okay, we're back to the pathophysiology review here. And as we're doing this, we're looking at basically these ones are really definitions. And so we're not going to do too much but go over the definitions of these. Menorrhagia. So make sure I'm drawing here. So when we go to that, we're looking at menorrhagia. And menorrhagia is excessive heavy bleeding during your periods. During menstruation. Polymenorrhea. Polymenorrhea refers to cycles that occur less than 21 days apart. So you're having them more frequently. And then dysmenorrhea. Dysmenorrhea refers to painful menstruation. And there can be a number of reasons for that. The next thing we're going to look at is testicular cancer. And when we look at testicular cancer, we're going to look at the fact that, first of all, it's a cancer, right? So that's always part of the pathophysiology and the etiology. So with testicular cancer, testicular cancer is often painless. Okay, so the pathophysiology is like other cancers where there's this proliferation of cells. The cells become non-differentiated, non-functional. They become a tumor. The tumor can become the tumor will become more of, if the cancer progresses, it will become more of something that's malignant, and eventually, it can be something that can metastasize. Processes that are included in this include initiation, promotion, and proliferation. Okay, etiology, again, it can be something that is the etiology is something where they can have anywhere from genetic reasons to environmental, just like other cancers. Then we move on to menopause, and menopause is that point where a woman has stopped cycling. And what I mean by stopped cycling is that the woman, so basically the stopped cycling. So basically the woman has no longer, and it's usually late 40s, 50s, where perimenopause happens, where estrogen declines, female hormones decline and they stop cycling. And so the etiology, boy, just getting older, and women are not fertile forever. The clinical manifestations, the signs and symptoms, women can report the fact that they don't get enough sleep, so sleep problems. Definitely hot flashes. Probably one of the most common things are the hot flashes. Women can get irregular periods while they're going through perimenopause. They can get night sweats. Pain after intercourse. Which is called dyspareunia. And then decreased vaginal secretions. Mood changes. Night sweats. We already said that. Sorry about that. And then they can also get decreased bone density, increased risk of MI. So after menopause has occurred, the individual then has that increased risk of MI where they have the same risk now as men. Prior to menopause, they had less of a risk. They also get a decreased bone density. So this next one, cryptorchidism. So there's this failure of one or both testes. To properly descend. They should descend down into the scrotum. So it is a birth defect of the male genital tract. So it's a birth defect. And it typically occurs when it doesn't move down to that proper place in the scrotum before birth. An infant is going to have a tough time telling you this, but this can be associated with severe growing pain if the undescended testicle, that spermatic cord becomes twisted. And so when that portion becomes twisted, what can happen is then we're getting less blood supply down to the testicle. So the scrotum upon palpation will be smaller, or it might be called underdeveloped as well.